2-minute warning.
Well, good afternoon. Before I begin, I just want to share a message with our farmers. We're doing everything we can to help you out right now, and I'm 100% behind our farmers, and I will always have your backs. But I need your help as well. We have to make sure that testing is available to our farmers and to the workers. That's our best defense right now. So I'll say this again. If you're working on a farm and you're worried about COVID-19, please go get tested. Tomorrow we'll have more to say on a plan going forward that will protect our workers, protect our farmers, and get the Windsor region on track to join the rest of the province in stage 2. But today, I'm asking all the farmers to cooperate and ensure that testing is available to their workers. And if you work on a farm and you test positive for COVID-19 and you need to self-isolate for 2 weeks, you're eligible for WSIB. You'll be protected for your time off, so there's no excuses. Please go get tested. Since the start of this pandemic, our province of 14.5 million people, we've all worked together, and we can't stop now. And for most regions of the province, we're back on track because we put health and safety first for everyone, just like we have for our children. We made it a priority to ensure our kids can continue learning from the safety of their home. And when I became Premier, I made a commitment to parents. I promised you that we'd get back to basics. I promised our kids would learn the fundamentals once again so they could succeed in today's world, because the system we inherited was failing them. Half of our students were not meeting the provincial math standards. It was completely unacceptable. And our government took decisive action. We launched the largest consultation on education in Ontario's history. We listened to thousands of parents, experts, and educators. We released our new vision for Ontario's education system, one that placed a renewed focus on skilled trades and STEM subjects, such as science, technology, engineering, and math. We made a critical investment of $200 million in our 4-year math strategy. And today, I'm incredibly proud to announce the release of Ontario's new and updated math curriculum for grades 1 to 8. This is the first new elementary school math curriculum in 15 years. It's clear that a lot has changed since 2005, and our children's education needs to change with it. For the first time ever in Canada, students from grades 1 to 8 will learn coding along with financial literacy skills as part of the math curriculum. This means that starting in grade 4, students will learn about saving and spending. From grade 5, they'll start learning how to budget. From grade 6 onwards, they'll understand financial planning. These are everyday skills needed for lifelong success. And that's something every parent wants for their children. So starting in September, parents can look forward to a math curriculum that not only goes back to basics, but equips our next generation of leaders and community builders with the math skills they need to build a brighter future for all of us. And from where I'm sitting, that's a promise made, promise kept. And because of these changes, I've directed the Minister of Education to cancel EQAO tests in grades 3 to 6 for 2020-2021 school year. Together, we'll get through this, and Ontario will be a brighter and stronger place for all. Thank you, and God bless the people of Ontario. Now I'll pass it over to Minister Lecce.
Well, good afternoon. We know that for many years now, math scores have been on a steady decline. It's why, under the Premier's leadership, we campaign on a promise to get back to basics and ensure our students are set up for success in today's competitive global economy. It is also why last summer we unveiled our 4-year math strategy to finally get our kids back on track when it comes to math. Nos élèves ne peuvent plus être lésés pour le compte. Our students can no longer be left behind. It has been 15 years since the math curriculum was last updated, and the world has changed since then. And so must Ontario's curriculum to keep up with the job market and with the future economy. We must set our students up for success and with a real competitive advantage when they graduate. We know that many of the jobs of tomorrow and today will increasingly require the skills and knowledge that the old curriculum just wasn't addressing. Fewer than half of grade 6 students met the provincial standard in math. That was down from 61% in 2009. For grade 3 students, for example, only 58% met that standard, down again 5% from 2015. As the Premier said, this is unacceptable. Parents have been clear, job creators have been clear, educators have been clear, and today our government is taking action. It's why we're proud to release the province's new elementary math curriculum that gets back to basics, and it starts this September. I'd like to walk you through the key changes in the new curriculum for grades 1 to 8. First, we're focusing on fundamental math concepts and skills like learning and recalling math facts, including multiplication. Yes, parents, that means memorizing timetables is back for our kids. Second, for the first time, all students will learn how to code. Starting in grade 1, computational thinking will give our students that competitive advantage. Third, financial literacy. Codified throughout the curriculum, it's brought into the earliest grade, at grade 1, to teach students critical life skills such as personal budgeting and understanding interest in debt. And last, using relevant, current, practical examples so students can connect math to everyday life, leaving the theory-based learning to the past. We know for a lot of students, math can also be challenging and a common source of frustration. To help students feel confident in their learning, we have also incorporated material on social emotional learning skills to allow students to learn from mistakes, to build perseverance, and support their overall well-being. This curriculum was developed by some of the brightest minds in the province. Its development was supported by leading-edge research and advice from academics, from math education experts, from job creators, industry, nonprofit leaders, and of course you, our parents. With today's announcement, we're also unveiling an interactive digital format of the math curriculum on the newly launched Curriculum and Resource website. So for parents, what this means is you're going to be able to easily see what your child's learning in the year prior and what they will learn in the current year, and how they will prepare them for learning in the next year. These side-by-side views on the digital platform make it easy for you to see how your child's math learning will progress. Parents can go online right now at ontario.ca/curriculum. So much has changed over the past 3 months, let alone over the past 15 years. We cannot delay, nor can we hope for improvement, unless we take decisive action to give students a credible pathway to post-secondary and ultimately to good-paying jobs. Thank you.
Okay, we'll go to the phone line for questions.
Before we go to the phone line, and we're joined by Dr. Williams and Dr. Dirk Heyer, better known sometimes I say Dr. Dirk, but both of them have been absolute champions in increasing the testing. You've heard me talk about Dr. Heyer and talked about the team, Matt Anderson, how the testing has increased with the support of Dr. Williams. They're the reason. They're the brains behind the operation. I just want to thank both of them. They're doing an incredible job. I want to give a shout out to Dr. Ahmed in Windsor, Essex. You know, he's doing a great job. He's taking a lot of heat right now, but, you know, he's working his back off. And to the folks at Windsor, Essex, we're going to get back on track, and we're going to do it as quickly as possible with the support of the farmers and the workers. You know, I feel sorry for the people of Windsor, Essex, and the workers and the farmers, but we're gonna get through this. We've ended up getting through everything else, and we're still moving. By no means are we finished, but I just want to reassure the people of Windsor, Essex that I'm behind you, and we're going to get on track with the rest of the province sooner than later.
Okay, we'll go to first question.
First question comes from Caroline Alfonso from the Globe and Mail. Please go ahead.
Hi, Caroline.
Hello, Premier. Hi.
Hi.
This question is for the Minister of Education.
Yep.
Minister, why are you canceling EQAO for the upcoming school year?
Well, as the Premier noted, you know, we want to make sure that our students, our educators, and the entire education ecosystem is able to embrace and learn the new curriculum. We're unveiling a new elementary math curriculum, and we don't want to impose any stress on our young people. We want them to focus on adapting to this learning and to a curriculum that I think really reflects the priorities of parents and ultimately the necessary skill sets required in the job market. And so the recommendation and the direction we're providing is for grade 3 and 6 EQAO math tests to be waived for this year as that learning commences, whereas grade 9 EQAO assessment would continue. And we are looking at a digital means to deliver EQAO assessments this year and into the future.
Follow-up?
Minister, is this the right time to roll out a new curriculum, a new math curriculum, when we're kind of uncertain about what the school year will look like come the fall?
You know, for the past decade, we have seen rather tragically every year, without exception, either at best stagnation or at worst real decline in math performance. I would argue from a competitive landscape, we must take action immediately to improve math scores. We were given a mandate by the people of this province to go back to basics, bring a math curriculum that actually reflects the priorities of the job market. There is, you know, it is not, you know, disconnected, the fact that we have twice the rate of youth unemployment, the fact that there's a 200% you know, debt to income ratio for young people in this province. We've got to do better at the foundations of math, numeracy, financial literacy. These are the things that we know we need to do better at. And so I appreciate the broader challenge around us, but we must move forward with these necessary reforms to give hope to these students that when they graduate, they can aspire to get a good paying job, a job related to the future economy, a job that could, you know, give them a yield to own a home one day. That should not be an aspiration lost with my parents and grandparents' generation. If we get this right today, we could literally change the course of the workforce, give them every opportunity to succeed in entrepreneurship, in leadership, in computational skills. I am proud that, yes, starting this September, students in grade 1 are going to learn about financial literacy. They're going to learn about coding. I mean, only British Columbia and Nova Scotia have that capacity in Canada. You know, the United Kingdom has it, very few jurisdictions. We've got to do better. And if we want to give our young people that competitive advantage that our government speaks about, it requires action immediately, which is why we're starting today.
Next question.
Next question comes from Travis Denrash from Global News. Please go ahead.
Hi, Travis.
Hey, Premier. I do have two serious questions, but on a lighter note, are you planning on getting a haircut tomorrow?
Well, you know, everyone's asking me about this haircut, and I'm not going to get a haircut until everyone in the province can. I'm standing beside the people of Windsor, Essex. It's not fair that they can't get a haircut and I can go out and get one. So I'm going to stand with them, and I'm not going to go to any patio restaurants either until everyone in this province can go there. And I'm going to support the people of Windsor, Essex. I know it's not much, but I'll continue supporting them. So I'll get clipped after everyone else gets clipped down in Windsor, Essex. But I just want to tell the people I support them down there. And but thank you.
You'll go with the shaggy look. My next two questions are for the Education Minister. Minister, I do have a question about today's announcement, but Global News has learned that Peter Joshua has been removed as the Director of Education of the Peel District School Board. Can you confirm this and elaborate on this if this is the case?
Thank you for the question. As you know, the government last fall, serious allegations by the chair and vice chair and various trustees have been brought forward to the government on allegations of discrimination, particularly against black children, although it includes Islamophobia, anti-Semitism, and prejudice and discrimination against gay children and the LGBTQ community. Clearly, this board, the second largest in the province no less, required some change. And that's why we called in reviewers immediately. It's why I imposed binding directives on the board. It's why I called in an investigator, Arlene Huggins, a leader in the community and a lawyer, to investigate the board's compliance with those recommendations. It was clear in successive reports that not enough was being done, that these children continue to feel victimized within their schools. And in this province, in this country, we're proud of our country's leading to Canada Day, but we have to do better. And no child should feel isolated as a consequence of the color of their skin or their orientation or their faith. That is not this country. It is not the country we strive to build. And so that's why we called in that investigator. It's why I then gave 2 weeks' notice to the board to get me a plan, or we would take additional action. The board did request a supervisor. We followed through the next morning with a commitment of cabinet to proceed with it, bringing in a supervisor. In Bruce Rodriguez, we have done that. A former deputy minister who actually built and approved the equity secretary within the ministry. He was a former director in Toronto Catholic following their supervision. He was the former superintendent at Waterloo that built equity programs, and as a proud educator himself, he focused on at-risk kids. As the CEO of EQAO, his focus was on helping students get ahead, particularly from lower-income families. He has a passion for this, and I am confident he will lead forward. And today, yesterday, as you know, I gave direction to the superintendent to drop litigation against community members because of actions taken by the board. And today, the superintendent has taken action, and indeed it is true, to find new leadership for the board, for Peel Region, to really re-inspire these kids, to change the culture of that community, and to do better for racialized children, for all children in that community that has for too long felt isolated and discriminated against.
And just on today's announcement, Minister, is it not a tall order, this is a follow-up on Caroline's question, is it not a tall order in the middle of a pandemic to expect educators to get up to speed on a brand new curriculum, students to learn a brand new curriculum without having a clear idea as to what the school year is even going to look like in September?
We're going to be teaching curriculum to students this September. I choose a curriculum, and my preference is a curriculum that is relevant to the job market and actually relevant to the skills needed for our students. We're going to be teaching math in September to students one way or another. And our preference as a government is to proceed with reform that actually gives young people an opportunity to graduate and ultimately get into post-secondary with a pathway to get a job, a good paying job. And so we are, of course, cognizant of the environment we're in, but we also appreciate there's an imperative globally and provincially for us to move forward with a plan that reflects that modernization. And that's why, to be fair, the curriculum that existed in 2005, lots changed since 2005. I mean, YouTube was just launched in 2005. Xbox 360 was just unveiled in 2005. A lot has changed, and so should our curriculum. And of course, we have to proceed in this basis to drive the necessary transformation our kids deserve. We've decluttered this curriculum, reducing the expectations by 150, focusing on 6 strands that are critical to young people's success. We're offering mandatory professional development of all educators before September to really enable them to succeed, consistent webinars and access to development, because we want them to do well. And we recognize that for elementary educators, the challenges ahead. That's why we're equipping them with more PD, more investment, more support, and it's why we're giving every school board in the province more funding to successfully open in September and get our kids back on track.
Next question.
Next question comes from Cynthia Mulligan from City News. Please go ahead.
Hi,
Hello,
Cynthia.
Premier. This question is for you, please.
Yeah.
There's a growing number of evidence that suggests that having a mandatory mask order is effective and could potentially curb the spread of a second wave and of COVID-19. Why are you not being proactive and doing a no mask, no service policy in stores, for example?
Well, we're encouraging everyone when they go out, and especially when they go into stores, to wear masks. But this would be a good question for Dr. Williams.
So we've been looking at the research with masks and the social behavioral aspects related to that. It's much better if the public agree and endorse that by wearing them voluntarily. And we want to emphasize that. That's part of the idea behind the social gathering limitation and the social circles. That when you're out, you take precautions to protect yourself. You do it not because you're forced to, because you want to do it and you want to do what's best for you and your family and your friends around you. At the same time, we understand there's certain areas that are different in the province. There's some stores and facilities. We are asking our local medical officers of health to use their powers and authorities if they feel they need to do so, if they feel there's undue risks being taken, and they can take action to do so. That's one of the advantages of Ontario. We have that variety to deal with the uniqueness and differences around Ontario. In the end, we want everybody to do what they need to do, and we've seen that so far, and we're sure that Ontarians, if they're advised and we keep them aware of the possibility of secondary waves and prevent those, that by being vigilant and wearing a mask, by doing your 6-foot distancing, by maintaining your circles, we can keep that at bay. We may even be actually able to flatten a secondary wave, but we have to do it together. And as the Premier said, he's seen evidence of how Ontarians pull together on that, and I think we can do this again.
Follow-up?
Okay, Premier, I'm going to direct this again to you. You may want your health minister or Dr. Williams to answer it, but you know, just last week we saw a big hardware store, Home Depot, have 14 staff members test positive. If you go into big stores, I would say maybe 50%, maybe depending on where you go, people are wearing masks. So do you think if you had a mandatory mask policy, that actually then it would become a habit for people? And isn't that what needs to happen, so that it's just automatic for people when they go inside shopping?
Well, first of all, we have to police it too, and we just don't have enough police, enough bylaw officers in the province to police it. I guess you could put the stores in charge. If they don't have a mask, they don't get in. I know a couple big retailers are doing that right now, but I will pass it over to the Minister of Health. Thank you.
We don't believe it's necessary to mandate the wearing of masks. It's just asking people to use their own common sense. And we're seeing that. We're seeing that in situations where they can't keep that physical distance of 2 meters, 6 feet, that they wear the mask when they're in closer spaces, in close proximity in stores, other retail establishments, perhaps on transit. People are being extremely responsible, and we think that that is sufficient at that point. If it changes in the future, we may take a different view of it. But at this point, people are being very sensible. They are wearing their masks largely when they're out in public, and certainly when they're in close physical spaces.
Next question.
Next question comes from Randy Raff from Stage TV. Please go ahead.
Hi, Randy.
Hi, Premier. In Hamilton, there's a lot of disappointed restaurant and bar owners who have been turned down for patio licenses by the city. The city saying that they are abutting on residential areas, and in a lot of cases, we've looked at the people that live in the residential area, residents abutting the parking lot or wherever they want to put their patio, agree to having the patio there. Should cities and townships be more open to letting restaurants and bars open patios?
I think they have to be flexible, but I'm just wondering why the city's doing that. You know, they're in stage 2. They should be able to do it as long as they follow the protocols in place. But I think people of Hamilton want to get outside and maybe have a cold soda somewhere and a cold pop or whatever, and sit down on a patio. So I would have to call the mayor of Hamilton and ask him, you know, the justification behind doing this. Unless Dr. Williams sees a different point of view, I think it should be all right, as long as it's a patio and they follow the protocol.
I'm wondering, what is going on the province's beaches? We saw on Cherry Beach the overcrowding on Saturday. On Saturday at Sherkston Shores on Lake Erie, there was a group of people that invaded a private beach and started throwing beer bottles at each other's heads. Crystal Beach on Lake Erie, a private beach was invaded and people were defecating on the beach and just leaving it there. In South Bruce, in Essex, including Southampton, the beaches were opened, and now the towns have closed them again because of inappropriate behavior or reckless behavior. Are you worried that when you open the beaches in the provincial parks that we'll see a similar scene? How can this be avoided?
I hope not. People have to be responsible, and I can't picture middle-aged people and seniors throwing bottles at each other. So I'm assuming what you're talking about is younger people just going hog wild and having party. But I'm going to give you a message to the young people. You think you can't catch COVID. You can catch COVID, and I have some numbers. I'm going to read these off just to wake up some of the young people who think it's all right to go out and party and hang out with everyone they want. So this is numbers from overall cases. So ages 0 to 19, 1,394 people have caught COVID, 4.3%. From 20 to 39, 9,006 people. That's 27.9. So you hear those numbers. Those are staggering numbers. Matter of fact, that's one of the highest areas. So 40 to 59 years of age, that is 9,910. So the two biggest categories are from 20-year-olds to 39 and from 40 to 59. And then 60 to 79, it's 6,283. And then 80 plus is 5,716. Now, people think they're like Superman out there. I'll tell you the deaths, 0 to 19, to the exception of today. I understand a 19-year-old passed away. My heart condolences go out to their family. That's the first. But 20 to 39, 11 people have passed away from COVID. 40 to 59, 101 people have passed away, 4%. And then 60 to 79, 678 people have passed away, 26.6%. And the largest is 80 plus, 1,760 or 69%. So my point with that, Randy, is, young people, they need to be responsible. Vast majority are. Vast majority of the young people that I know, I got 4 girls, ages from 24 to 30, and their friends, everyone seems responsible, but you get a few cold pops in you and you start going wild. That's unacceptable. And if it continues going on, then we'll talk to the regions and they'll shut the beaches down.
Next question.
Next question comes from Alison Jones from the Canadian Press. Please go ahead.
Hi, Premier.
Hi, Alison.
I wanted to ask about your comments off the top. You struck a far more conciliatory tone towards the farmers today than yesterday. I'm wondering if you heard some feedback from them after your comments yesterday. I imagine they probably weren't too pleased to hear some of what you said.
Well, I was just speaking the truth, and I love the farmers, and I talked to the farmers last night, talked to them this morning, talked to OMAFRA this morning, talked to our health table, and we want to help these people. But I'm not going to hide behind the truth and put everyone in jeopardy. I'm going to be there for them. I'm going to support them. We have $15 million. I'll do anything I can to support the farmers. But there's a lot of tension right now in Windsor, Essex, and I just need to cool the temperature there. And we're going to resolve this like we've resolved majority of things together. Not the government. We only do it together with the cooperation, be it the farmers or the workers. But I'm going to pass this over to Dr. Heyer, that's been leading leading the testing, and he can explain some of the strategy, and we'll be elaborating on this tomorrow. So, Dr. Heyer, if you have a.
Thank you, Premier, and good afternoon, everybody. So, the farm industry generally across the province, but specifically in Windsor, Essex, have been working closely with the local health providers, the hospitals and Ontario Health, as well as the local medical officer of health, to try to understand most effectively whether there is additional illness within their farms to ensure the best protection for all of their workers, because that is crucial. They have crops, they have brought people into the country to help support the work and the food chain that we all benefit from, and really taken many, many steps working with the federal government, working with the provincial government, working with the local medical officer of health and the hospitals and others to provide the best care. This flowed from work that the hospital started doing in response to some early infections that were identified within some of the farms, and the hospitals and the medical officer of health were doing specific health checks of the workers, and they recognized that there would be additional benefit to provide further health opportunity, and so the hospital and others within the community developed a multidisciplinary health opportunity that includes testing, and that is, we're actively involved with those. I am working together with Ontario Health to support the implementation of that and working closely with the farm providers and also with Dr. Williams and the medical officer of health to provide the best opportunity to ensure that all of the farms are staffed with those who are in good health, and any health opportunity that's necessary we're providing for them.
Follow-up?
Thank you. Yes, I have a question for the Premier that's a little out of left field, so to speak. The Blue Jays could start training as soon as July 1st under MLB's proposal yesterday. Could they use the Rogers Centre to train without the 14-day quarantine in a proposal similar to what the NHL has done with Toronto? Do you see any way for games to be played at the Rogers Centre, considering all the visiting teams will be coming from the U.S.?
I better, honestly, Elson, I better hand this over to the Commander-in-Chief, Dr. Williams there. Thank you.
So we've received the proposals and had discussions with the NHL, and they have incorporated what they would do if they came to Canada with the federal quarantine law and how we would work with the Chief Public Health Officer of Canada and to incorporate that into a bubble type concept. The Major League Baseball proposal, I've seen it and read it. It deals with a lot of aspects there. It doesn't mention anything about travel to Canada at this time. So if there was some interest in that, we'd have to get a proposal from them to see how they would undertake the uniqueness of bringing the team, and if they thought about bringing other teams up into here to play, how they would work with that up until such time as the federal government reduces or eliminates their quarantine law. But that's still in place at this time. We have ways that we worked with NHL to consider that. I have not seen anything specific with Major League Baseball yet at this time.
Last question.
Last question comes from Lucas Meyer from News Talk 1010. Please go ahead.
Thank you very much. I think this question is probably for Minister Elliott, actually. I know you've taken questions before about how we include positive COVID-19 cases and deaths, but with regards to the one that we unfortunately just read about, the young girl, the word from Toronto Public Health is that she died of health complications unrelated to COVID-19, but did test positive. So I'm just curious if you want to reiterate why that is being categorized. If it's unrelated to the COVID-19 positive, why it's being listed anyway?
Well, first of all, any death as a result of COVID or where COVID is situated is a tragedy, as it certainly was in this case. Like to extend my condolences to the family of this young person. It's a terrible thing to lose a child, but in some cases, I'm not saying specifically with respect to this case, but in some cases there are situations where there are other pre-existing conditions that may actually be the cause of the loss rather than COVID. COVID is there, but may not have been the cause of death. But again, it's going to be subject to an investigation by the local public health officers to follow up and to make sure that anyone who was in the presence of this person, this child, receives the proper follow-up and testing if it's necessary for them. But again, my condolences to the family.
So can you just kind of elaborate a little bit on that, Minister, about if there's going to be a subsequent investigation and the local public health unit is suggesting that it is unrelated, why it's still being listed in the official provincial numbers?
Okay. For this, I'm going to ask Dr. Williams to provide further information.
with the Premier's permission, because we understand as the age of the child, it was referred to the coronial system for investigation. So I think on that basis there, Toronto Public Health does their investigation, but with permission, I'll ask Dr. Heyer to comment on its perspective from a coronial investigation aspect.
So unfortunately, wearing my day-to-day hat, it's always sad when somebody passes anytime. And the Premier spoke about the tragedy of COVID and the number of deaths that we've seen, especially in the elder population. And just my condolences to all family members and everybody, friends and communities who have lost their loved ones. When we are involved in an investigation, and I will confirm that we are involved in this investigation, we look at all aspects to try to understand the circumstances of death, and that will involve testing, evaluation of the body through an examination, but also additional testing, looking at the pathologists, forensic pathologists will look under the microscope, and so many of those take a period of time. But when we find something in early tests, if it's something that's required to be notified, then we will let the reportable disease be known to the public officer or the medical officer of health. And the reason for that is while the death may not have, and I'm not providing whether it is or isn't because it's still work in progress to understand, when there is an infection found, it's important that anybody who may have intersected with that child, whether that child was specifically infected and died or didn't die from COVID, the fact that it's found, need to ensure that everybody else knows. And so that's why it's reported. That's why that information would come out. And sometimes, as Minister Elliott so appropriately said, sometimes people do die without necessarily being from COVID because the virus can be found. The testing is so sophisticated, it can be found still remnants of it without it necessarily being an infection at that particular time. And that actually speaks to more than specifically at the death situation, but also in the life situation. So it is work that we're still trying to evaluate. We don't know exactly the role at this point, but important that it gets notified and therefore would lead to public reporting after that.
Okay, thank you, everyone.
Thank you, everyone.